Have a great local story for CBC Vancouver? Tell us what's important in your community and why by sending your pitch to mylocalstory@cbc.ca or post on Twitter, Facebook, or Instagram with the hashtag #MyLocalStory, and you can see it on CBC Vancouver News. Well, yes, we have been telling you about an initiative that we are very excited about, My Local Story. Basically a chance for you to tell us about stories that you think are worth telling. And tonight, the first story in an ongoing series brought to us by a viewer. And it's all about a woman's battle with cancer and her battle over parking. Bal Brach is here to fill in the details. So, Bal, start from the beginning.
Well, Andrew, 2 years ago, Nancy Pilling was undergoing treatment for uterine cancer. For months, she had regular visits to the BC Cancer Agency on West 10th in Ash. And during her treatments, Pilling parked on the street and plugged the meter. It's about $3 an hour there. She estimates spending about $300 on parking alone. She also ended up accumulating about half a dozen parking tickets from the city. And that's what she's hoping to change for others. Now that she's completely healthy, Pilling is asking the city to start a decal program that would offer free street parking for patients undergoing cancer treatment.
I think it would be very easy. Look at gyms, they have decals. Is it any big deal? You go in there, you show your driver's license, they write down the decal number, and they give it to you.
Now that sounds simple, and the BC Cancer Agency sometimes waives parking fees in their lot for those who can't afford it. But Pilling says she wants the city to show some compassion by giving cancer patients a break on street parking. I spoke to the City of Vancouver's Director of Transportation, Lon Leclerc, and he says a program like this just wouldn't be feasible for the city. Leclerc says it would be hard to manage and enforce. He says metered street parking is meant for short visits with quick turnarounds.
The challenge that we have with the on-street parking is it's so oversubscribed. I mean, the only tool that we have to monitor the use is pricing. And our target actually is so that on a block like this, our target is that there would be 15% of the parking spaces available at any one time. And that's so that when you're driving to this area for all of those important trip destinations that you're making, that there's a parking space available for you. If we relax that too much, what ends up happening is the whole street's parked up. And then the whole intent of that casual, quick turnover parking is diminished.
People outside the BC Cancer Agency today. One elderly gentleman in particular struck me. He was parked at a meter waiting inside his car while his wife was receiving treatment. He told me he's on a fixed income and parking is just too expensive. All the people I spoke to today agreed that free parking would really help alleviate some of the hardship cancer patients face. But the city says it's just not feasible.
All right, Bal Brach, thanks a lot. So let's explore this a little bit more, because you might be thinking street parking, it's not the only kind of parking available, right? There's also hospital parking. What about that? Well, the cost of that can vary from hospital to hospital, but to give you a few examples, parking at the Vancouver General for a full day will set you back $18.75. At the BC Women's and the BC Children's Hospital, it's $14.25. At the Richmond Hospital charges $15 for a day pass. In New Westminster, the Royal Columbian charges a bit more, $16.25, and that's also what they charge at Surrey's Memorial Hospital. Then there's Delta, where parking is free. The city has actually banned pay parking in that municipality. Now, I want to bring Dr. Vanessa Bursick into the conversation because, Dr. Bursick, you're with a group called Canadian Doctors for Medicare, which is, in part about breaking down barriers to access to healthcare, and money is a big part of that. So when you look at the parking issue, one question I had, what's stopping hospitals themselves just from taking the lead on the parking issue and just making parking free? Wouldn't that go some distance in alleviating the problem?
So hospitals are increasingly turning to foundations, lottery, parking, and cafeteria to help increase their revenue. The solution to that, I think, has to have two layers. The first layer would be to offer easy-to-access rebate programs for people who can't afford parking. That would be the very first step. But the second step is to actually reform the system such that services can be provided in more cost-effective ways. We've heard that pharmacare could save us up to $10 billion annually, and then that money could be put into reducing costs for patients, such as parking.
So when you are looking at this particular issue of paying for parking, which, admittedly can add up to many hundreds of dollars depending on the case, should the onus, do you think, be on hospitals to provide free parking? What are the issues there?
The issue is there's a lot of costs that patients suffer from that are outside of the services that we're able to access for free under Medicare in Canada. And that includes parking, but it also includes other transportation costs. It can include prescriptions, home care. And so there's a lot of costs that people have to pay for when they are struggling with illness or disability. And parking is only one of them. So we need to offer financial support and programs to allow people who have a hard time paying for the externalities to healthcare to get through those hard times.
Would you say parking represents a significant part of the problem? Because, you know, as we were seeing in Nancy Pilling's case, the bills, I mean, they add up to hundreds and hundreds and hundreds of dollars over a period of days, weeks, or months.
Transportation is definitely an issue. Whether a person is taking transit and having to walk long ways while they're actually very sick, or whether they have a car and they're able to drive but then have to pay for gas money and for parking, or whether they have to find somebody to drive them to the hospital. But transportation is a really big problem for patients to be able to get around.
So until, you know, some of the changes that you've been talking about, until any of that happens, what kind of advice do you give to people who are having to deal with, as you say, a lot of expenses out of pocket?
Well, we're starting to see more support for people to be able to look at income and address issues of poverty as they relate to healthcare. I work with a nonprofit society called Basics for Health Society that in BC is trying to build capacity to actually offer hands-on support for people to figure out what programs they're eligible for and how to increase their income monthly.
All right, Dr. Bursick, good to talk to you.
Thank you.
Now, this story did come to us directly from you as part of our My Local Story initiative. So if you do have a story that you think is worth telling, send us an email at mylocalstory@cbc.ca, or you can send us a message on Twitter, Facebook, or Instagram. Just be sure to use the hashtag MyLocalStory.